Welcome back. The World Health Organization, has responded to the decision by newly inaugurated President Donald Trump, the US president, to pull his country out of that organization. It says this is regrettable, especially because the US is a founding member of the WHO, which was launched in 1948. It serves more than 190 countries. In the meantime, the African continent faces a series of recurrent and ongoing health threats. Let's take you live now to Davos in Switzerland, where the World Economic Forum is underway, and bringing Dr. Jean Kaseya. He is the Director General at the Africa Centers for Disease Control and Prevention. Dr. Kaseya, it's a great pleasure having you on the program. Shall we begin with that decision by the new US President, Donald Trump, to pull the US out of the WHO? What are the implications here?
Thank you for having me. You know, as leader of health in Africa, Director General Africa CDC, my interest is the health of African people. And the US is the main partner that we have in Africa. And the US is providing a large spectrum of services to African people. And I think it's time for us to understand the decision that is made and to see how we can overcome this challenge for African people.
It's in line, though, isn't it, with the kind of stance globally that Donald Trump has been taking and has been saying in his campaign speeches he would be taking, of an America First approach to his term in office?
Yes, you know, I think African people, they know what they want. American people, they know what they want. In Africa, we don't vote for an American president, but we consider any administration in the US as a partner of African countries. And at the continental level, we are approaching the new administration and working with them to see how we can leverage appropriate resources and support to African agenda. And this one will be a win-win because they will make America great again, while we'll make Africa great again. I think this is the message that we are giving to each other. There is a win-win for all of us.
Dr. Kaseya, it seems a long time ago now, but COVID-19 wasn't that long ago. We are a world that wants to move on very quickly, aren't we? What are some of the lessons that we learned, particularly as the African continent, on not only our own ability in the wake of a pandemic, but the kind of assistance that we can expect from the rest of the world when it comes to things like COVID-19?
There are two major lessons that we learned from COVID. The first one is inequity. The second one is weak health systems in Africa. When we talk about inequity, we talk about lack of access to vaccines, medicines, diagnostics that we faced at that moment. And when we talk about weak health systems, we know that our continent was not prepared. This is why we decided at continental level, and our head of state, they make a clear decision first to support the agenda of local manufacturing of our health commodities. And we are moving with this agenda. Second, to build strong surveillance system with decentralized laboratory network, because we want to know what is happening where and when. And third, to build strong capacity in terms of human resources to be able to manage all of these outbreaks that we are facing. These are major lessons that we learned, in addition to appropriate and respectful partnership that we must have. I think it's time for us now to consider that Africans, Europeans, Americans, we are all human beings, and we all want to have access to medical countermeasures at the same time when there is an outbreak.
And of course, it didn't end with COVID-19 for the African continent, Dr. Kaseya. There's been recurring emerging outbreaks and public health threats on the continent: Ebola, Marburg, Mpox, to name just a few?
Yes, you know, Mpox, I have to call it a wake-up. After COVID, Mpox is a major wake-up for the African continent. It's the first time that Africa, through Africa CDC, has to declare a public health emergency of continental security, even before WHO declaring that at international level. It means first we have strong experts who can sit, analyze data, and recommend a decision to the Director General. The second one is we managed for the first time to put in place one team, we call it Incident Management Support Team, that developed the Continental Response Plan with one budget. It means today when we are talking about Mpox, we are talking about one team of 29 partners under the co-leadership of Africa CDC and WHO, sitting together to support the response. We have great success, while we are still facing some challenges in terms of morbidity and mortality in some countries. But we made a lot of success based on the approach that we decided to adopt.
And Dr. Kaseya, what steps, and perhaps you can take us into your confidence about the kinds of conversations that are taking place at the World Economic Forum in Davos, but what steps is the Africa CDC taking to strengthen our preparedness as a continent, and how are other member states collaborating there?
Yes, this year Davos is mostly about artificial intelligence, how to leverage on artificial intelligence to make the agenda of development moving. I think from our side as Africa CDC, we believe that artificial intelligence can also help the continent to push the agenda of public health. How we are talking about how to make all of our health centers connected for timely information for decision-making process. The second one, we are talking about how we can also accelerate with initiatives like telemedicine. If everyone can get connectivity, that is possible. We can use these examples that we see in other countries, other continents for telemedicine. We are also talking about how to strengthen our surveillance system by using the digital system. And lastly, we are talking about how to drive the agenda of development by using the health sector as the entry point. I think all meetings that we have in Davos this year are inspiring us too much. And when we'll be back in Africa, we'll see how to start to implement all of the lessons while we'll reinforce where we are doing very well.
I think, Dr. Kaseya, you've already touched on this, but perhaps you can talk just a bit more about some of the gaps that remain in Africa's health security and how the CDC is working to breach that. And, you know, when I think about gaps, the first thing that comes to mind is the impact of climate change.
We have a number of gaps or barriers for the health security in Africa. The first one, we are talking about human resources. As you know, we have a gap of 5 million health workers in Africa. And every year, some of the medical doctors, the nurses we are training, are moving to other continents for reasons we know. Then, Africa CDC is implementing an initiative, we call it 2 million community health workers. This community health workers will be the bridge between communities and the health centers to support our communities to get access to appropriate care. The second gap, we are talking about access to medical countermeasures. It means medicines, vaccine, and diagnostics. We know that we are not at the level of 60% we are targeting for 2030, but the agenda supported by Africa CDC of local manufacturing is moving. But I still consider that as a gap till when we'll achieve the target. And the third one, we are talking about the domestic resources in Africa. And as you know, we are depending almost at 90% of what is coming from external partners. I'm glad to inform that our head of state, they will meet on the 14th of February in Addis Ababa to discuss domestic resources for Africa and how to provide appropriate funding to Africa CDC and African Medicine Agency. I think all of these initiatives will help Africa to have strong surveillance system in place and to prevent, even to respond to outbreaks every time that we can have this event in Africa.
Dr. Jean Kaseya, let me thank you for your time. Live to us there from the World Economic Forum. He is the DG of the Africa Centers for Disease Control and Prevention in Africa.